Hello, Cornelia Pringle returning. Just want to talk about today. I want to talk about referral, reported record keeping, and consultation. And that would really conclude the 12 core functions as well as the 46 global criteria. Keep in mind that if this is only a supplement to getting ready to test by the IC&RC board. Okay, so we're talking about referral. Referral really begins at the onset of screening. I want you to keep this in mind when you're looking at clients' needs, what the problems may be. Just keeping in mind of the client's needs. Knowing that some of those needs our agency may not be able to meet. So you want to keep that in mind. So that's identifying the client's needs. You're also going to explain to the client the rationale that a referral, why a referral may be needed. For example, we talk about HIV. Client needs to be screened, need to be seen at the health department. We don't do that here at this agency, so you would need to make a referral. Just keep it in mind, referral and case management can get kind of mixed up, but today we're talking about referral. Keeping in mind matching the client to its needs and the appropriateness of the resource. For example, if a client does not have any, may lack educational skills, may need a GED or want to get a high school diploma depending on the age, you may refer to Central Piedmont Community College or Urban Ministry, Urban League. If you're here in Charlotte area, you may want to make a referral like that. However, if someone is looking for employment, you don't want to send them to school to Central Piedmont Community College when he's looking for employment. You may want to direct him to the Employment Commission, the employment office for looking for employment. So you want to make sure you're just matching the needs with the resources. You want to also adhere to the laws of confidentiality, making sure that there's a signed consent form if you're making a referral to a person at the employment office. If there's a name in particular that you build a report to, if you have someone at Central Piedmont that you talk to, if there's a doctor office, if there's a health department, that you want to make sure that you have a consent form signed by the client with just what information is needed for the exchange. You don't want to send the whole client's record. So you want to make sure, that the client just initial, just parts of it. Don't go checking everything, okay? You want to protect the client. Assist the client in utilizing the support system and the community resources that's available. When meeting with the client and there's a person-centered plan that's developed or a treatment plan that's developed and you identify its needs and you put that on there, put the referral where you plan to make the referrals, put that on the treatment plan too, on the PCP, so the client can have an ideal plan of where he's headed and the things that he said that he wants to work on. Okay, so I have talked about 5 global criteria to referral. The explanation, this is in order to be competent in this function, the counselor must be familiar with community resources. If you first time on the job or working for a new agency, find out if they have a resource guide. See if you can put your hands on it So you can have a copy at your desk. If a client needs information, you'll have it right there. It's good to build your own self a library where you can have access to all of that information up front. So when talking about report and record keeping is very important from the beginning because it is the client's record that have a list of different documents in it. Okay, the demographics may be in there. The financial information will be there. Any consent forms. You may have letters from probation officers. You may have some other court documents. There's a whole lot of documents that goes in this client's chart, and you are to maintain that chart by documenting every time you have contact with this client. And it's not a bad idea to document when you don't. Meaning that if a client doesn't show up for group, or if he misses the appointment, or if you reach out to the client to try to make contact with the client, it's good to document those things. You want to make sure that you document pertinent information, progress, lack of progress, the diagnosis should be in there. Those type of things are needed. Where you, when you last saw the client and what that session was about, in case that you're out sick or that you go away and on vacation and someone else needs to manage that case while you're gone, that they can be able to pick up the chart and pick up where you left off at and be familiar with what's going on with the client. That's a hard thing to get a client and you don't have no documentation. You don't know what's going on with the client. Your supervisor, she go to look, there's nothing there. So you want to make sure that you document what's going on, that you keep good record. Keep good record. There's only 3 global criteria to report and record keeping. So it may be in the scenario, there may be 1 or 2 questions question about documentation, but just make sure you know it. You want to show that you're competent in this area, even if it's by writing or when you get on the job, that you want to make sure that you understand the importance of documentation. So different agency uses different formats for documenting their progress notes. Some agency may use SOAP, and I believe that's on the test. So if you're not familiar with SOAP, I suggest that you take the time out to research what that means. And then the PI format. Purpose, intervention, and effectiveness. Now, some people they still call it PI, but some people use the purpose, intervention, and the assessment, So just be familiar. Be familiar, knowing that purpose is the purpose of the session, sometimes the purpose of the goal, the intervention, what you did. And I always like to tell clinicians that when you write a note like that, you want the effectiveness to indicate what you did, the progress, how the client gathered, what he learned from what you did. You always want to show that. It'd be a good note. I look at it as good paper. And then there's consultation. Okay, consultation can take place between you and other staff members. If there's a medical doctor or a psychiatrist on hand, that you can communicate with that person if you are having some difficulties. It talks about in the core function, recognizing issues that are beyond the counselor's base of knowledge or skills. It may be something that we're not familiar with. It may be a case that we haven't ran into yet, that we need some help. If it could be medical. If you see a client in your office and he's breaking out with something, or he's itching all over, or his behavior is in a way that you have not seen before. It's a time you can make sure you have a consent form if you're consulting outside the agency. Most of the time within the agency, if it's other staff or if there's a doctor on staff, you normally don't have to have a consent because it's in-house. But anytime you go outside the house, you need to make sure you have that consent form. Consult with appropriate resources to ensure the provision of effective treatment services. Yes, if you know that a client is not appropriate for your agency, that you see something else outside of substance abuse or outside of mental health that's beyond your scope, you want to make sure you refer that out. And you would need to consult with someone if you're not sure. You want to adhere, once again, to the applicable laws, the confidentiality of disclosure, of identifying client, if you need to say what the client's name is or not. Sometimes you have to be careful with that, because even if you're making a consent, even if you consulting with the Department of Probation or Parole or the employment office or the health department, you can call there and just get general information or ask general questions. But if you do not have a release, do not mention the client's name. Okay? And then again, you want to make sure that you explain to the client your reasoning. A lot of times, it's okay to tell a client that in staffing, we're going to staff your case today, and these are some of the concerns that I have or some feedback I would like to get, or we're just going to discuss your progress. We're going to discuss whether or not if it's time for you to step down to a lower level, or if it's time for you to step up to a lower level. Those things needs to be discussed when a client may have positive urinalysis. That's all up under, your program and your guidelines and your rules and things that you look at to demonstrate whether or not if a client is making progress or lack of progress. Please make sure you go over your 12 core functions and that you be familiar. And also, the getting ready to test. If you are sincere about wanting to pass the exam, I suggest that you study. Good luck.